A patient who traveled to West Africa had flu-like symptoms in Columbus, Ohio, tested negative for Ebola today.
But emergency rooms are on high alert all over the country, including here in the tri-state. Medical reporter Liz Bonis stopped by Mercy Health West Hospital to find out what they are doing to stay prepared.
It is not uncommon for Doctor Kevin Meyer to have his team on high alert each day for patients who come in who are very sick and for infectious diseases, which the Centers for Disease Control says could make all of us very sick. In addition to that, however, they're also on high alert for something all of us are hearing about these days, Ebola. That's because we live near an international airport, and that means a patient potentially could be exposed to that and travel to our area.
We have been circulating some information to our physicians just to be on alert that the threat exists, and to ask the question on your typical patients if they've had any travel or been exposed to anybody from Western Africa.
The travel question is key. The World Health Organization says more than 1,600 in West Africa have now been infected with this virus. It causes flu-like symptoms. So they say to be prepared against its spread,
we have to wear protective garb. We have gowns and masks, and we also have things that look like spacesuits to put on.
Those spacesuits are needed for anyone in close contact. This virus is not airborne.
Correct. It's more of a droplet, so it's kind of a blood, sweat, and tears type of thing.
Patients can be placed in what's called a negative pressure room as well,
which basically just contains virus particles and infections within a specific room.
Since there is no real treatment for Ebola, testing and observation right now helps determine the next step for proper care. At Mercy Health West Hospital, Liz Bonis, Local 12 News.
And screening precautions for Ebola are being taken at airports for those boarding planes to the U.S. from West Africa.